Thanks very much, Penny. Slightly strange experience knowing that there are many of you out there and not being able to see any of you, but thank you so much for having me. My name is Joe Potter. I'm Policy Manager at Samaritans. We have a particular policy interest in this group, and while Ellen's presentation is going to focus very much on sort of operational, reaching people through services, my presentation is similar, but from a policy and a research point of view. So if we could have the next slide, please. So the bulk of the presentation is going to be based on this report, Out of Sight, Out of Mind. It was published earlier this year, pre-COVID, it should be said, but many of the themes that came through in the report have a particular resonance and are particularly relative for the COVID age, unfortunately. One of the things I'm going to try to be doing is to bring through some insight from Samaritans' helpline, and sort of pointing out where there is some sort of concerning overlap between what we found through this research and what our data from the helpline is telling us. If we could have the next slide, please. So this slide really just speaks to, and many of you will be really well versed in this, but why Samaritans, why all of us are so concerned about this group, middle-aged men, when it comes to suicide. The figures for 2019 that came out last week or the week before last, the ONS stats back up that, again, it's men who are 3 times more likely in England and Wales to die by suicide compared to women, and that the middle-aged men being the highest risk group is persistent, has gone on for decades, and that this is really also an issue of inequality and deprivation. So the poorest men in the most deprived areas are 10 times more likely to die by suicide than more well-off men from more affluent areas. Obviously, there are notable exceptions to this, but as a general trend, this really is an issue of disadvantage. Thank you. Isolation and loneliness is going to be a sort of a feature of this presentation, and it was certainly a feature of the report. So there being an association between suicide and loneliness, we've known for a while. I'll come on to a bit more of this later in the presentation. If we could just have the next slide, please. I think it's really important to say that there is no single reason. Again, this won't be a surprise to many of you, but there's no single reason that alone that men take their lives. It's there are myriad reasons. It's a complex issue, but we know there are some issues around men being more likely to engage in risky behaviour when struggling, a tendency to have fewer strong social networks outside of their relationship. Then the second point down, that men can be less open to talking about emotions and have fewer social skills than women. It's something that comes up in the evidence, but actually Ellen's presentation will come on to some interesting challenges to that. That definitely needs to be the idea that broadly men don't talk. I think definitely needs to be challenged, and it's something that came through in our research, but comes through more strongly in Ellen's presentation that follows mine. If we could have the next slide, please. So, as I said, this research, Out of Sight, Out of Mind, took place before the COVID outbreak, but actually, unfortunately, it reflected a lot of what the caller data, which I'm going to go through, sort of tells us. So, forced isolation, disconnection, even before lockdown, were major problems for the group of men that we're talking about here, middle-aged men on lower incomes. So we found these men to be really disconnected from the people around them, the places around them, from networks around them. And, you know, of course, that are just going to be exacerbated in many cases by lockdown. What we're starting to see at the moment around job loss, it's really starting to ramp up at the moment, and we know that the furlough scheme ending is likely to have an even bigger impact with that regard. You know, out of sight, out of mind really showed us how important work is, not just financially, but also socially to this group. So again, the issue of being disconnected from networks is likely to become a bigger feature of, and probably not so well spoken about, but a sort of a continuing feature of job loss also. The next slide, please. So Samaritans has undertaken a survey of our volunteers, 3 surveys of our volunteers in March, May, and the most recent being in June. It's probably unsurprising and echoes what Penny said, that people are more anxious and more distressed than before the COVID-19 pandemic. Specifically for the issues we're going to be speaking to in this presentation today, many callers have been worried about losing their jobs and businesses, as well as being furloughed. And actually what we're hearing is from the people from the people running our helpline, is that now those fears about the future, losing a job, losing your business, these are actually starting to come to fruition now. So they're transferring from fears to actuality, and we're getting more calls about that. You know, anxiety around being unable to pay rent, mortgage, and inability to support the family, which we know for many middle-aged men is such a important source of identity. And so again, there's the financial impact of losing your job. There's also a sort of loss of self, which is particularly important for this group. Fear of homelessness, all of these things that unfortunately now are starting to become more likely. Have the next slide, please. A lack of social support. So again, this is probably unsurprising, but you know, a reduced access to previous social networks, but also, you know, just the you know, popping into shops, the less formal side of socialization that people have, but are losing. The very, you know, speaking to someone in your local shop, or just being cut off from the world, around you is something that comes up again and again in the service. If we could move to the next slide, please. And a lack of access to mental health services. So people are telling this is an increasing problem, even as services start to come back online. That can be quite patchy. It's not working for everyone, and that actually services like Samaritans, the Samaritans helpline, is stepping up where more formal clinical services would have formerly taken that role. So yeah, it's another distressing, and a lack of access to support is something that came through really strongly in Out of Sight, Out of Mind. If we could move on, please. So Out of Sight, Out of Mind is going to be the sort of the bulk of this now. So again, if we could move on to the next slide. We undertook 16 in-depth interviews with middle-aged men across the UK and Ireland. So really trying to dig down into their experience. We wanted to go for the depth rather than the breadth of experience here. So we really wanted to understand what these men wanted from services when they were struggling, what they were getting, what they weren't getting, how their needs were being met or not met. The current evidence base, there's lots of good work going on. There isn't necessarily a really strong evidence base to back that up. And that's what we were trying to add to. And that last point, exploring what these men told us worked for them when they come into contact with support services, was the key, the crux of this report. We found that away from services, long-term stable work was really important in terms of routine, purpose, and providing a social network. And that actually, we spoke to these men when they'd been through a crisis, and when you tracked that crisis back. There were many reasons for it, but ending of work was really a common theme for that. And obviously, knowing what we know about forthcoming redundancies and recession, that should be of particular concern. So George, one of the research participants, said that he completely underestimated the impact of his work ending. You know, his colleagues had become his friends in a big social network, and when he lost that, it was, you know, had a massive impact on him. Next slide, please. Social disconnection was incredibly important for all of the 16 men that we spoke to. I definitely thought that we were going to hear more stories of the impact of directly of poverty, of loss of income, of you know, and that was of course part of the story. But I think if there's one thing I took away, it was about a lack of connection that these men had. And actually, again, as you trace their experience and their journeys, as it were, what you see is a slow but sure dropping off of connections from when they were in their 20s right through to their 40s, 50s, and 60s. A striking feature was about the years that these men struggled with poor mental health, with suicidal thoughts, with suicidal feelings, and in some cases attempts. And there really just being no support network around them, despite this sort of long chronic problems that they were having, where some people did have good social connections. Unfortunately, this wasn't always the case, but in some examples that really stood out, those connections were based around substance misuse, alcoholism. So they didn't necessarily have the protective factors that you might hope social networks would provide. We could move to the next slide, please. Ian told us that he was embarrassed to talk about depression with other people. Very isolated. He was alone and didn't have anybody or see any way of having anybody. Next slide, please. From a policy point of view, it's really important to note that there were opportunities to engage these men way before they met crisis. There was, you know, an example of a guy coming in and out of the in and out of prison, go to the job centre, addiction services, lots of places where you think, okay, this is an opportunity to intervene and to help this person get back on their feet. But again and again, we had stories of those opportunities being missed. So support being framed narrowly also when it did arrive. So looking at, for instance, substance misuse without asking the men more holistically about what they were going through and what they needed. So of course, substance misuse is something that needs to be dealt with, and the man needs to be supported through that. There was a whole other set of issues around disconnection, around purpose and meaning that just didn't get spoken to. And really crucially, the men that we spoke to didn't see services that were about sort of helping to get them back connected with their community. They weren't seen as relevant until they reached a crisis point. Next slide, please. So crucially, what should interventions focus on for this group? The men told us that inclusive initiatives based on peer support and shared experience were really important. So when they walk into a service, when they get referred or self-refer into a service, they want to feel like the people around them have some sort of sense of shared experience, that the person at their side understands what they're going through. They want to feel also that what they're doing is organic. It hasn't been a local CCG, or it doesn't feel like the NHS has decided there are a lot of vulnerable men in this area. We're going to put a service in here and we're going to make you better. It was important that the services, the initiatives they got involved in felt organic. Next slide, please. George emphasized this, one of the research participants, with the importance of it. It doesn't matter what the activity is, it's about having a commonality, a common feeling they want to do this thing together, be that crochet be that football. Next slide, please. Purposeful goals were really, really important. This is what the men told us too. You know, the men that we spoke to didn't want to feel like the beneficiary of a service. They wanted to feel like they were working together to achieve something, to work towards a sort of common goal, a common good. They didn't want to feel like they were being fixed. They were willing to speak about what they'd been through, how they were feeling, but they didn't want that to be the focus of the service. That needed to be a happy offshoot, the kind of byproduct of working together, getting involved in something that they felt that they could contribute to. That the talking about how you feel will come as an afterthought, an important but afterthought. And by focusing on projects, by focusing on contribution, you can kind of help to sidestep the issue of stigma, the issue of what's wrong with you, how can we help fix you because you are broken. That's what you want to move away from. Next slide, please. Tom told us, you know, it's about getting perspective on his life by speaking to others. It's by helping other people that he could kind of help himself. And obviously, this won't be the same for everyone. There will be some people who need mental health support, you know, and counselling and that sort of stuff. And it's important that the people that require that get it. But for the men that we spoke to, it was a kind of a different route to feeling better. The next slide, please. So Jack told us it was about, he felt that people could rely on him. You know, he was trusted, he was contributing to something. That made him feel so much better, having responsibility, not being able to care for others rather than being cared for. So a really powerful quote to end it. I think I'll finish up there and hand over to Ellen.